Chapter 6 is medication side effects, reactions, and interactions. So your side effects can be broken into two different categories of side effects or reactions. The first category is local. When someone is experiencing a local reaction or a local side effect from a medication, the reaction is only occurring in that one spot where the drug touched. For an example, if you go and get a flu vaccine, if you ever have gotten a flu vaccine, I know with me, my arm will be stiff, it'll be warm, it'll hurt, right? But it only occurs where the drug touched. It's local. It's only in that one spot. I don't feel that warmness, that stiffness. I don't feel that all over my body. It's just in this one area, making that a local reaction. Okay. The second category is systemic. Systemic reactions occur throughout all of the body system. So when you look at systemic, you'll see system in there. So the reaction or the side effect or experience, you're experiencing that through all of the body systems. So, for an example, when I went and got my flu vaccine, of course, it did hurt. I was having the local reaction where it was stiff and it was hurting, it was sore, it was warm to touch. And then later on that night, I would probably say 2 a.m., 3 a.m., I woke up with 102 fever. So now that local reaction has turned into what type? Systemic.
Yeah,
So now I'm having a fever, I'm having all of this other stuff, right? So the reaction has spread, right? Okay. So that's how those are the examples of those two. Local, it only occurs just like having a rash from a patch. You won't see the rash all over the body. You'll only see that rash where that patch was. Okay. Local. Systemic means that the effect, the side effect, or the bad reaction is occurring throughout the whole body. Okay. A class is a category or a type of drug. So a drug class, we could say benzodiazepine or benzos. That is a drug class that every drug that falls under it is supposed to help relax you. So that's like your um, Xanax and Ativan, things like that. Okay. So everything in that one drug class does the exact same thing. Another one would be antihypertensive. Every drug that I list under antihypertensive, all are going to lower the blood pressure. They're all doing the same thing. Okay. All right. Talk about that. All right. I want you to skip to slide 6. So again, these are just giving you examples of side effects that are local. So injection site pain and irritation, just like I experienced with the flu vaccine. And then oral thrush, I want you to highlight that. Oral thrush related to inhaled corticosteroids. So if we are given a inhaler and the inhaler has a corticosteroid in it, you what happens if you continue to use it and that steroid sits on top of the tongue, is going to develop into oral thrush. So in order to stop that, I need to instruct my resident to rinse their mouth out after every use. If not, it's going to build up on the tongue. And when somebody has oral thrush, that can be painful. That can be aggravating. So if their mouth is hurting, are they going to eat? No. So what's going to happen to their nutrition? It's going to go down. What's going to happen to their weight? It's going to go down, right? So to stop that from happening, instruct your residents to rinse their mouth out after they use their inhalers. Okay. We talked about that. All right, go to slide 11. This is discussing anaphylaxis. So we already know that anaphylaxis is a severe allergic reaction. So the first thing that I need to do when somebody is experiencing a severe allergic reaction, I need to call for help. But I don't leave the resident. I stay with them. This is the time I will let you yell and hey, let me get some help in here. Okay. The next thing that you're going to do is remove or stop the aggravating factor. So, for an example, if they're using a breathing treatment and they're starting to have a severe allergic reaction where their tongue is swelling, their lips are swelling, turn it off. That's removing or stopping the aggravating factor. Then the dose of epinephrine needs to be injected into them, and then they need to be monitored. In actuality, 911, and then they need to go so they can be checked out. Because you can give epinephrine, and then after a while, that same that same anaphylactic reaction that they were experiencing can come back. So you don't have time. If my patients are no longer stable and I'm a med tech, they're no longer mine. It goes over to my nurse at that point. Your residents need to be stable because you haven't been taught how to assess. Assessing is not in your scope of practice. So if I got a resident whose blood pressure is sky high, that is no longer my resident. That's the nurse's resident. Okay? Because like again, if you give this epi, let's just say we don't send them out and we give them epinephrine, 30 minutes to an hour pass by, next thing you know, their lip is starting to swell again, their throat is starting to swell again. That's why I say send them out, because that's a lot of monitoring after that. That need to be one-on-one monitoring at that point. You don't have time for that. So all of your residents that are assigned to you have to be stable. Okay. A lot of your residents are taking a lot of medications, and I mean 10 pills, 15 pills, 20 pills, right? And so that is called polypharmacy. They're taking a lot of pills. So a lot of those can interact with each other. A lot of those meds. Some meds can interact with each other and cause one pill to work very well. Some can interact and cause another pill to not work at all. So the physician has to be very mindful when he's writing prescriptions and looking at their med list and say, well, I can't prescribe this med because it's going to interact with this one. So, and that's also what you need your pharmacy for. Right? Your pharmacist will let the physician know. Okay. But what can happen when they're taking so many medications? They can start to exhibit drug tolerance, which means that they will no longer feel the same effect that they were feeling before. Usually that'll happen with narcotics. They're on narcotics and they've been taking it, let's just say 10 years. Eventually, you're not going to feel the same effect. So now their body has become tolerant to it or used to it. Okay. Cross tolerance happen if, let's just say, if I'm already, let's just say I'm allergic to something. If I am allergic to penicillin, right? Anything that ends in cillin, I'm going to be allergic to because it's in the same drug class. Okay. If I have developed a tolerance to penicillin, I'm going to have a tolerance to amoxicillin. I'm going to have a tolerance to ampicillin because they're all in the same drug class. That makes sense? Okay. So that's okay. I want you to skip to. So again, drugs can interact with each other. Um, Drugs can interact with certain diseases that people have or health conditions that they have. Drugs can also interact with food. Skip to slide 23. So these are some common interactions. The first one I want you to highlight is grapefruit juice. Grapefruit juice interacts with many medications. Okay. Usually your heart medications, but many medications, grapefruit juice will cause the medication to not work properly. Okay, so we have to be careful with that. Calcium containing products can decrease the effectiveness of some antibiotics. It's just the same as if somebody is taking oral birth control and then they have to take antibiotics. The antibiotics can cause the oral birth control to stop working. So then people can be pregnant. Say, wait a minute, I'm on birth control. You on birth control and antibiotics at the same time. Okay, so stop it. Vitamin K and vitamin K rich foods decrease the effects of warfarin. Warfarin is also known as Coumadin. That is a blood thinner. If the whole point of warfarin is to thin the blood because this person has a heart attack or a stroke, vitamin K clots our blood. It's a clotting factor. We get vitamin K from over the counter supplements or food. Vitamin K rich foods are your green leafy vegetable, green spinach, salads. So if I got a resident that is on warfarin, what do you think I need to tell them about their diet? That, there you go. So they can't have say, hey, I know you like to have your salad. Now let's just say that they have a salad, one salad every other day. That's fine. They can increase the amount that they eat. So if they were having a salad every other day, once a week or twice a week, okay, that's fine. They can't go from once a week or twice a week to having one every day. Okay? So we would have to educate them on that. Because if they're on the blood thinner and they're heavily consuming green leafy vegetables or vitamin K supplements, it's defeating the purpose. Their blood is clotting, and we don't want it to. Okay. Alcohol should be avoided while taking several types of medications, especially antidepressants. Why? It's gonna make it worse. Both of those are depressants, right? So alcohol is a depressant. They're already depressed, right? So if they're just drinking, that's going to increase suicidal ideation. Okay. All right. So that was chapter 6.